Hey everyone, welcome to the Live Well, Love Strong podcast. And today I'm very, very excited. I have a special guest. His name is Dr. Sarat Susarla, and he is a pulmonologist with the Houston Specialty Clinic. And Mary Elizabeth has been seeing Dr. Susarla since we've been in Houston, so it's been over 10 years. And what I love about Dr. Susarla, and other moms in this area say the same thing every time we talk about him, is that not only is he super, super smart, like wicked smart, but he's very down to earth and accessible. And he kind of, his bedside manner is very compassionate, it's very kind, and it's also very aware. So we talk a lot on this podcast, Doc, and I'm going to give you a second to get going about, when we go to the doctor, we don't always get the information or the questions answered. It's, sometimes it feels like a rush or it's just really a stressful time, especially for new moms and new parents of kids with disabilities and medical complexities that they're still just trying to learn everything. And Dr. Chusarla is like a big deep breath when he walks in the room. So anyway, welcome, Doc, and thank you so much for being on.
Thank you. Thank you very much for the invitation. It's nice to chat with you. Look forward to the conversation.
Awesome. Okay, so tell me a little bit about your background and how you became passionate about pediatric pulmonology.
Sure, absolutely. Yeah. So the pathway to this specialty that I'm in, which is a pediatric pulmonologist, pediatric pulmonology and sleep medicine is our practice category. It's kind of long. So it means going through doing your bachelor's in science in my case, getting a medical degree, completing medical school, then doing a residency, then doing a
Right?
postdoctoral fellowship. So at some point, you got to get the inspiration to do all this stuff. So for me, it began with a discovery about being in love with pediatrics. And
Mm,
so the best way to discover your interest in pediatrics is to have good mentors. So that
yeah.
probably started in my medical school days. The pediatricians were generally the happiest people. They seem to be the well-adjusted, most balanced people too. So that was a great starting point.
Yeah.
And but then after that, once I just made the decision to do my pediatrics residency, then again it was discovering some nice mentors in the specialty field because general pediatrics is such an extremely important area
Yeah.
for being able to bond with the right primary care doctor who can set the template to help build trust and tell you what to be worried about and what to look for. But then from that point on, you start developing some interests in categories of pediatric medicine. So for me, the science of breathing, the science of sleep and breathing all started to become very appealing. And
Hmm.
so pulmonary medicine became a very important discipline for me to investigate. So I got interested in pulmonary medicine.
I love that. Okay, so what exactly is pulmonary medicine and what are some of the most common like conditions that you treat in kiddos?
So the discipline is called pediatric pulmonology. And if you poll the average person, they'll say pulmonology. That's hard, right? And then of course it's like a dagger into our heart. Like, no, it's the most important organ. So no, it's the science of lungs and the science of lung diseases. That's the best way to explain it. But it goes a little bit beyond that because it may also include just respiratory or breathing disorders.
Hmm.
So it may not be something wrong with the lungs to say
Right.
per se, but something that goes wrong with the lungs, maybe as a secondary consequence of another condition.
Hmm.
So, lung diseases, the lung disorders, and breathing disorders. And so, what do those entail? Well, when the discipline was first started, it was really to help properly study and manage kids with cystic fibrosis. So,
Yeah.
your audience members may know cystic fibrosis is a very common um, condition that affects the Caucasian population and can lead
Hmm.
to chronic severe lung disease. So they needed some specialized doctors to manage it. And then pulmonary medicine became a great place. Now, just turns out my office doesn't do much with cystic fibrosis. And if you needed to go see a doctor who spends a lot of time and has all the latest and greatest information about cystic fibrosis, nowadays you go to what are called CF centers or cystic fibrosis centers. They have national funding, they have multidisciplinary teams. So what does a pulmonologist do besides CF? So it includes very common conditions like asthma.
Yeah.
It includes kids who have unexplained frequent infections in the lungs.
Hmm.
It includes children who have recurring exercise-related breathing problems. Your audience may know that there are a lot of preemies who leave the hospital who have disorders related to their prematurity. So premature related lung disease or
Right.
chronic lung disease or prematurity is a very big one.
Hmm.
And then there's some congenital structural disorders that relate to the lung. And then there's some conditions, like I indicated, that really have nothing to do with the lung per se, but there's maybe a neurologic disease that makes it
Right.
easier for you to develop a lung issue, or metabolic diseases that the same thing occurs. So there's a whole panoply of conditions that fall into that category that are not lung diseases per se. So if you have that issue and it's a chronic problem, chances are you benefit from seeing a pediatric pulmonologist because they have some of the state of the art information about how to manage those chronic conditions.
Yeah, I like that. Okay, so let's say I'm a new mama and I have a kiddo, and we've been in the, we were in the NICU, and we're home now, and we have some issues with our lungs. And we have our first appointment with the Houston Specialty Clinic and Dr. Susarla. What are some of the things as a doctor are you like hoping for in creating a new treatment plan, or like, getting to know the new patient? I'm trying to help mamas who are coming to the doctor for the first time and they're overwhelmed and it's a huge learning curve. So what are some of the things that you suggest that they have ready for the doctor, or things that they should know, or things that they should be asking?
Yes, yeah, that's a great question. I think one of the reasons why that question is so important is because not all moms, not all parents bring their children to a specialist's office and have any idea why they're there. So often, let's just talk about maybe someone coming out of the NICU. And so the NICU is a location where preemie babies spend a lot of time getting over diseases of prematurity, let's say lung disease, and they might go home, unfortunately, on some medications for their lungs or some oxygen that's being given to the baby. Well, who's going to follow up on that? Who's going to manage it? And so the
Right.
neonatologist will say, "Well, I need to hand this off to a capable doctor who knows how to do that." So that's generally their thought process. But in our practice, we're thinking more long term too, which is we want to help walk you through the process. We want to give you sort of a roadmap of what to expect. We want to explain how the, in this case, prematurity can lead to other conditions and how to anticipate them, how to prevent them. So we want to give you a whole sketch over the next year or two of what to expect and how to follow things, not just one or two items about your discharge.
Hmm.
So when it comes to a specialist visit, particularly a pediatric pulmonologist visit, bring your records, bring your information, bring your questions. That's
Yeah.
probably one of some of the most important things, which is that you may not know what to ask, but it doesn't hurt. You can start asking a lot of questions. And believe it or not, you're going to hear a lot from us that you may not have been thinking about until you decided, well, what should we be thinking about in the future? And I like to spend a lot of time focusing on what things to look for.
Hmm.
So, many times I have parents coming into the office and there's just a long paper trail. There's just a long list of things that they've been going through. So it takes time to internalize all that. Your doctor isn't that good. I'm not that good. I can't internalize information that fast. I got to spend some time going into it, but we can start with a sketch. And
Yeah.
so where did we start? Where did we get to? And what are some of the little stations that we've had along the way? Have we been in the hospital multiple times? Have we had to
Hmm.
see a lot of specialists? Are we getting a second opinion? I'm
Yeah.
actually one of these doctors that loves the idea that if you saw another lung doctor before, well, okay, that's great. Now, so let me give you my flavor too.
Hmm.
I don't think too many opinions is a bad thing necessarily.
I love that, doc. Yeah. I love that. Okay, so they're coming in, they're bringing their records, they have a list of questions. I have advised to bring a friend or a partner or your spouse or an aunt or an uncle, somebody that you trust, because as the family or as the mom or dad, it's quite emotional in the beginning. And like you said, there's a lot of, different specialties that they've dealt with and all these new terms and stuff. And so I always say bring someone with you so that they calm you, and that, yeah, if you can't get through your list, they can help you get through your list. Okay, so what are some of, so Mary Elizabeth is one of Dr. Susarla's patients who is there for a different reason other than her lungs, right? So there's nothing structurally wrong with her lungs. There's nothing going on with her lungs, but she has cerebral palsy, which is a brain injury, which causes her to, kind of choke on her own spit and aspirate a little bit. And so we see Dr. Susarla to manage that. And a common treatment that we use for those sort of things, for protecting the lungs from pneumonia and from aspiration, microaspiration, we do the albuterol mask treatments. What are some other common treatments, or what are some other things that are like, I see a kid coming in with a lot of complexities. Like, these are some of the things that we're going to be talking about.
Yeah, absolutely. Yeah, so amazingly, there are some specialties like pulmonary medicine where you may spend less time on prescription medication and
Right.
more time on some therapies. And
Yes.
so this is the case for, let's say, a lot of children who have cerebral palsy, neuromuscular conditions, structural conditions that make it easy for secretions to get stuck in the chest. So
Yeah.
now you're talking about physical problems that can eventually lead to changes in the lung that can make you sick over and over again. These
Yeah.
are called disorders of airway clearance. Just means that if my trachea comes down here, branches into my right side, branches into my left side, subdivides into a bunch of small little branches, fanning out like a tree, well, those air tubes can get plugged up. They get plugged up with secretions. They can get plugged up because we don't take deeper breaths, deep breaths. They can get
Mm-hmm.
plugged up because we have structural issues around our lung, like our rib cage and our muscles, and they
Mm-hmm.
impair the ability to get things up. So that's the kind of category of problems that you're referencing. And
Mm-hmm.
so what that entails is looking for ways to keep that from happening, looking for ways to keep the secretions that start from here and from here to keep it from going into the lung or keep it from getting stuck in the lung. So you mentioned albuterol. And if some of your viewers hear about albuterol or Google albuterol, they'll say, well, that's an asthma medicine. And so it is an asthma medicine, but it's also a lot more. Um, in pulmonary medicine, we do a lot of off-label, out-of-the-box stuff
Yeah.
because we know it works and we know it's best practices. And sometimes those therapies open up the lungs, so secretions can come out.
Mm-hmm.
Sometimes those therapies should be assisted with devices that you wear around your chest that shake excess mucus to come out. You've heard of these things called CPT
Best.
vests,
Yeah. Yeah.
right? A fancy device that's very expensive and that insurance is loath to cover.
I was
But
gonna say it takes a
yeah,
long time to get a
oh
shaky
yeah,
vest.
you got to take some time to get it. Yeah, again, I mentioned cystic fibrosis early, originally invented as a therapy to sort of augment clearance of secretions in cystic fibrosis. And there's a whole other host of devices. There's something called a cough assist device, which forces air and sucks it out to help get secretions to come up. Power reduction is a must for many parents. There's some medicines that thin out the secretions in your mucus so that it's easier to cough up. So all the things that you think, well, what do I have a well child who coughed too much and has too much mucus. What do I do to get it up? Well, there's some kids, if they can't get that up, it's a life-threatening problem, or it's
Right.
a pneumonia infection, or it's a major quality of life problem. So these are the kinds of mechanical therapies, not necessarily all medication related, that we
Yeah.
utilize to enhance that ability. And they take some training and support because
Mm-hmm.
they'll come from medical supply companies. Insurance has to cover them, assuming we're still doing the insurance thing, which means your
Mm-hmm.
doctor has to say, yes, you so and so needs this because of these kinds
Right.
of conditions. And then someone needs to train you how to use that. And
Mm-hmm.
then you have to say, well, okay, I'm going to learn how to use it. And then what does that mean, that I become my own child's therapist? Hopefully not. Hopefully not. Hopefully you have the support team. Hopefully you bring your device to me and I show you some additional things on how
Yeah.
to use it. And that just dovetailing what you said about having help. When you need these kinds of things, you need help. You
Yeah.
need people to assist you with things. So maybe that's another caregiver. Maybe it is a home nurse, or
Mm-hmm.
maybe it's someone else that's an experienced healthcare practitioner. But yeah, we want there to be a team approach to managing these things. And so some of those devices require that, and that's what you're referencing.
Yeah, I love that. And I want to tell the story about how we got our shaky vest or CPT vest, like Doc was talking about. because you do have to, you have to play the rules and you have to document and get insurance to cover it because everything's so very expensive. And the CPT vest, I guess, Doc, and you probably know the exceptions, but they don't just give it to anybody. Maybe cystic
Yeah.
fibrosis gets it right off the bat, but we had to have other therapies and treatments that failed before we could apply for the CPT vest. And then once we got it, this is the lovely part about the support that Dr. Susarla was talking about is we had a respiratory tech come to our house, showed me how to set it up, how to work it. There is, it tracks hours, it tracks, how often you do it. So she just kind of showed me how the system works. And then they called and checked like month out, 6 months out, a year out.
Yeah.
I thought was really lovely and very supportive. And yeah, I wouldn't have known how to do it if I wouldn't have had that extra help. And so that is what it's supposed to look like, guys.
Right. Yeah.
and if not, then you call your doctor and you ask for support or you call your insurance.
And you get us to fight for you.
That's
That's
right.
what we do, right?
Yeah,
And
exactly.
so exactly right. And so, a pulmonary medicine means leveraging those devices, which many doctors might have heard of, but don't know how to
Hmm.
use or prescribe. We know how to prescribe them and use them, and they can be game changers.
Yeah.
If you had a daughter or a son who has ended up in the hospital over and over again, and they've ended up in urgent care, ended up in the ER, and there was a dangerous level of phlegm getting stuck in sections of the airway, and you didn't know what to do. That can be one of the most frightening moments,
Yeah.
I think, for a parent.
Yeah.
And so, what I want to do, what a pulmonary doctor should be doing, is giving you some tools so that that is not as frightening, that you
Hmm.
have a few step one, step two, step three methods to help dislodge those things,
Yeah.
and then know when you have to get help. And so that we
Right.
don't wait till the last possible minute. So
Right.
I think that's another goal for us, which is that if you'd been in a situation like that, how to avoid that again, and what are the steps to look for before it becomes severe.
Yeah. Okay. So let's do that. Let's talk a little bit about what a kid in danger looks like, beginning, middle, and then like super critical.
Absolutely. So, of course, it's disease dependent, right? So,
Right.
for asthma, it's one thing. For
Yeah.
children with recurrent pneumonia, for kids with cerebral palsy, they're all a little bit different, but I'll give you some sort of um, um, high level ways to look at it. So let's say it's recurrent pneumonia. Let's say it's secretions that are getting stuck in the lung. Well, what
Hmm.
are we getting into now? We're getting into school season, and school season means flu season, which means flu and RSV and everything else that you can think of that we get from the cold weather months. So you get those cycles of infections again and again.
Yeah.
Well, if you're a child who doesn't have a lung condition, doesn't have a hard time coughing up mucus, you get a cold, it runs its course for 3 to 5 days, maybe have phlegm for an extra few days, and then you're better, you're fine.
Right.
If you have a child who has a tendency to have secretions get stuck in the lung or deep down
Hmm.
in the airways, you need some method to get it out. So you might be used to seeing something. You might be used to saying, well, Mary, she got a cold and she was kind of wet sounding
Hmm.
for about a week to 10 days. But when I looked at her, her breathing rate was normal. So I might look at you and say, what's a normal breathing rate? How do I count a breathing rate? And you
Mm.
need to learn a few of these things, and we can
Right.
teach you those things.
Yeah.
You need to look at what's called work of breathing. And so
Yeah.
every parent that comes into my office, I teach them to look at their child kind of with their shirt off or with their shirt up so they can kind of look at their muscles,
Yeah.
because we're the breathing apparatus is something that is done passively. You don't have to tell yourself to breathe. It's under the
Right.
control of the diaphragm, it's under control of the brain and brainstem. But
Hmm.
sometimes you can see clues. The muscles are engaged, are actually working harder. The
Yeah.
stomach muscles are pulling in, the neck
Hmm.
muscles are pulling in, the nostrils are flaring. So you can see some of those things. So that's another level. So I
Yeah.
might have just wet noises and cough. That's level one. Level two might be that I'm having my muscles working harder. And level three, that they're working really hard and really deep. And if your child is a verbal kid, maybe can't even speak adequately
Right.
anymore.
Yeah.
And so these are sort of levels of respiratory distress, is what we call
Hmm.
them.
Yeah.
And notice we haven't said anything about a device, a
No.
monitor, a wearable, a nearable, or any of that stuff.
Right.
This is
You're
just
just
looking
looking,
at
right.
your kid.
And do you call the pulling in breathing? It's called retraction, right? Is that what they call
Called,
it?
yeah, it's called retractions. I mean,
Right.
anytime you see a doctor, they'll say, "Yeah, your child's retracting," and that means retracting because the stomach muscles are pulling underneath the rib cage. That
Yeah. They're
sucking
working
motion.
really hard to breathe. Yeah.
That's called a retraction. And so you can have deep retractions or sort of shallow retractions. And we don't like
Hmm.
any of them. But once it gets to sort of the deeper level and sort of rapid breathing rate, then we know we're in a situation where we better fix something now,
Hmm.
or we're going to be making a trip to the hospital, or we might be even calling 911.
Right. Yeah.
So those are sort of the, the steps to look at. Now, when it comes to conditions like asthma, and it comes to conditions that, they have a more of a medication-based strategy.
Hmm.
Parents may leave my office with something called an asthma action plan, which again, same thing. I don't want my parents to always be worried that what happens at 2 a.m. What do I do? Am
Right.
I always going to be rushing to the hospital? Am I going to be calling you? Of course, people
Hmm.
may call me. Of course, that's what
Right.
we're there for. But
Yeah.
I want them to have a little bit of a knowledge of, okay, first I'll do this, then I'll do
Yeah.
this. And
Hmm.
then if one, two, three, if we're stuck here, then I'm gonna reach out, or I'm gonna be going to the hospital. So
Hmm.
we have a similar strategy for asthma, which is the
Yeah.
amount of medication used, how much is tolerable, how much your child can actually be a little bit uncomfortable before we think it's too late and we need to do
Right.
something else.
Yeah, yeah, okay. I like that. I like that. I know we're not talking about numbers, and I actually don't think you get a pulse ox unless you're properly trained on it. But
Yeah,
just for our audience, just for
yeah.
for general information, what's acceptable saturation oxygen level, and what is something that, yeah, where we're like, hey, we should
Yeah,
check
absolutely.
that out.
To talk about a very easy to get, fairly low cost device. So home pulse oximeters are game changers because they can really give you peace of mind, but they can also really stress you
I
out.
was gonna
Okay.
say, right?
Can
Yeah.
really stress you out. Yeah. So first thing that you need to figure out is, and this is something that you can talk to your pulmonologist, you can talk to me about, which is this oximeter, is this device, is this going to be helpful for me? Yes or no? And a lot of times I'll say yes, but so here are the things that you got to look at, right? It isn't necessarily the cost of the device, but it's how to take a measurement.
Yeah.
You got to have a child who's calm, who isn't screaming,
Yep.
because if they're screaming and they're kind of moving around like this, one of the first things that affects pulse oximeter waveform is motion.
Mm,
Moisture affects it too. Temperature affects it too. So a
interesting.
wet,
Fingernail
cold,
polish,
moving
I know
hand.
affects it too, but
Oh
that's what
yeah,
I
you're
thought. Yeah,
right.
that's
And
right.
pigment can too. That makes it more complicated.
Yeah.
But yeah, so your answer to your question is, most healthy children, when they're awake, their oxygen saturation should be about 97 to 100%. 97 to 100% is their SpO2, or oxygen saturation.
Hmm.
When they go to sleep, it drops by about 3 points on average.
Hmm.
So therefore, it might be dropping down into the mid 90s or 94, and that's considered to be okay.
Hmm.
If you're in that mid 90s level and you're normally in the upper 90s level, by definition, you're low.
Right.
Now
Yeah.
the question is it really a good sample? Am I really measuring this right? So you go back to the
Mhm.
whole issue of, how do I measure this properly?
Right.
And if it is, then you got to look at some other things, which is there something else different today? Are we having new symptoms? Are we having new cough? Are we having new
Right.
fever?
Is there a
The
positioning or airway issue? Because I feel like that happens a lot too. That for new
Yes.
moms, like that'll get you sometimes if like just their head
Oh
is
yeah.
positioned wrong and their neck is just slightly off. Yeah.
Position makes a big deal. If you hear me speaking and I do this, you can hear my voice kind of changing as I put my chin to my chest.
Yeah.
So there are airway positions that impair breathing.
Hmm.
There are positions that impair breathing. And of course, there's some kids. Let's just talk about, kids. Sometimes kids with cerebral palsy, they can have effects on their rib cage and their muscles over their rib cage. They can have a neuromuscular effect, right?
Yeah.
And
Hmm.
so our lungs develop and they grow and they expand partly with the expansion of your rib cage.
Hmm.
So if your rib cage isn't expanding properly because the muscles around them aren't encouraging expansion,
Right. Yeah.
then you have a narrow space for your lungs to expand. And sometimes for kids with scoliosis, kyphosis, there's
Yeah.
curving of the spine versus actually bending of the spine, curvature of the spine. You will have part of the lung that's not getting enough air. So you might notice your child has a problem on one side, but better on the other side. And it can be
Yeah.
related to the side that's kind of being squished.
Yeah.
Yeah.
Wow. Y'all, this is like major stuff. I know that's good stuff. Um, okay, so how, let's say we are trying to create a plan for a new mom. We're with you. We're trying to advocate for insurance, which your office and a lot of places do really well. And that's one thing I want to say before I ask Doc the next question is that not all doctors, not all clinics, not all hospital systems are the same. There are superstars, and you should find them, and because it makes your
Oh,
experience very different. And I'll say, for support staff, you need to really look at that. So the receptionist, the nurses, the people checking you out, the people pushing your paperwork. So if you have a very complex medical kid, you want an office staff. Um, you might even look at them as much as you would weigh the pediatrician. I mean that like really because like you want
yeah,
to be able to, send them stuff and it go back and forth really quickly, especially when you're dealing with insurance. Anything else that you can think
definitely.
of or things that they should be looking for when they're choosing a facility or a specialist or a place to go? Anything that you know from the doctor's end?
Yeah, yeah. There's a lot of issues here. So it's 2025 now. We went through a pandemic period
Oh my God.
where doctors' offices were closed down and shut down. We're doing a lot of this kind of thing.
Yeah.
Um, and you needed a way to communicate with your medical team, be it
Hmm.
the nurse in the office, the medical assistant, the front office staff, the doctor.
Yeah.
We can talk about this more later. One of the benefits, at least of this COVID period, is now there's a stressing about how to access your medical team outside of a clinic visit. You
Yeah.
know, so I guess what I'm saying is you want to practice where they're definitely okay and they encourage you to message the team. They have a portal system. In a perfect world, we'd all be calling our doctor. We have their doctor's cell phone number, and we just call them up anytime. And those days haven't resurfaced yet. They may still yet, but not so far. You want to be able to access them in these secure portals that are now being used. Now, it means downloading a device on your phone or
Right.
those kinds of things. But on the other hand, it takes your headache from having to call the doctor's office
Right.
and put it in the message and then have someone answer the message and transcribe it. Now this stuff can actually be done securely in a secure HIPAA compliant portal. And
Hmm.
so you want to make sure you have an access for those kinds of things. I notice this problem is happening. What do you think should we do next? And I'll be the first to tell you, sometimes the messages are about that long. I say, you know what, we need to talk. This is going to be complicated. But sometimes it's the two or three nuggets of information that you needed to see and say, okay, this is what we need to do.
Yeah.
So um, some of this stuff can be done that way, right?
Hmm.
Whether it's I discovered that I needed a new medical device, I discovered I needed a new medical medication, and find out if your doctor's office is comfortable doing that kind of thing.
Hmm. Yeah.
So there's that type of technology and other tools related to practice that many doctors are becoming more and more comfortable using. You mentioned the insurance issue.
Hmm.
Um, I when I'm let's For example, we mentioned the issue of ordering a CPT vest.
Yeah.
If I did it right, what I said to you that time was, "This may not get covered."
Yeah.
And I said, "This is what's gonna happen." So I need to set expectations for you
Yeah.
that we're now go on say, a 2 to 4 week path of working to get this done.
Yeah.
So just anticipating that,
Hmm.
okay, what to do is also helpful. So if you don't have experience dealing with complex medical devices, even though we're supposed to be prescribing them and
Yeah.
managing them, when you have an office that's done it over and over again, they explain to you that we
Yeah.
have those expectations. You
Right.
don't be alarmed when you get a letter saying your doctor wrote so and so, and we're denying it because he or she didn't say the magic words.
Yeah, and that heads up from the doctor is so important for us emotionally. So, I mean,
Yeah.
because we are, especially in the beginning, we are, living and breathing these kids and trying to keep them alive and yeah, and waiting for everything. And so that can be devastating if we didn't know already, like, hey, this might be tricky or this might be hard. So, yeah.
Yeah, absolutely.
Yeah. Okay. So we're looking for good outside the clinic access. We're looking for someone who has a lot of experience, specifically if we're doing pulmonology in the therapy devices and the therapeutic devices that are prescribed. We're looking for I mean, insurance, I don't even know what's going on with insurance this day, but like, yeah, you should try to find a doctor who it's the only way, I think. I don't know how many people can afford to do it without, outside of insurance.
Correct. Yeah, I think insurance is still the crutch we all lean on for the time
Hmm.
being. It's the service that everyone's paying for, and you wish it would just give you the things that you need. And so it is our best it is our best third party system right now that
Right.
needs a lot of tweaking. So yeah, you work with an imperfect system, and you deal with denials, and it never fails that a heartbroken parent said, I got this message saying that this device or this medication was denied, and you're just crestfallen, right? You
Yeah.
can't believe it because we spent a lot of time talking to you about, I think
Right.
this is the right therapy for you, and you
Right.
said, yes, I researched it, I googled it, and I learned all about it. I said, yes, I agree with this, and then someone says no,
Right. And
and
it's
then and
usually an OBGYN, but anyway, keep going, doc. Yeah, that's right.
Yeah, it's usually someone that's not a peer. These days that the
Dermatology.
authorization processes are supposed to be something called a peer-to-peer, and what she's referring to is that sometimes the OBGYN or the radiologist is not my peer, although they're my friend and colleague. They're not in our specialty, and so we
Yeah.
want someone to kind of oversee that and say this is the right thing. So yeah, there's certain amount of fighting of that is required, and you don't always get your first choice,
Yeah.
but if you can navigate it properly, you can eventually get there. And the toil is often worth it in the end,
Yeah.
although you wish there were ways to shortcut it. So yeah, we have a lot of experience in doing that. So it is still a physician or medical provider navigated system that you need someone to help show you a way to get authorization for
Right.
unusual or complex
Yeah.
therapies.
Yeah, definitely. Okay. All right, Doc. We have like a few more questions, but is there anything that we didn't talk about that you wanted to discuss specifically?
Yeah, so I think that what I would say is this. So um, parents come to our office a lot, which is very interesting. Um, when they have research topics and they've discovered a condition that me as a pulmonologist or sleep specialist will be able to help advise on.
Mm-hmm.
We see that a lot these days, and it's no coincidence. The information age is here. We can
Right.
Google everything. Sometimes parents say with chagrin, "Yeah, I Google this. I hope it's okay." And actually, it's okay because you're learning things, and you're learning
Mm-hmm.
things from good sources and not such good sources. What I'm getting at is that i- there's too many conditions and too many complex specialties for your general medicine doctor or your general pediatrician or your primary care doctor to know everything.
Yeah, good point.
And so they don't necessarily know everything. And so one of my goals in the community here in the greater Houston area, particularly, is to kind of improve awareness about complex conditions,
Yeah.
unknown conditions, chronic diseases. So you as a parent who have been very committed to improving the health of your child, you may come across something that you discovered that wasn't mentioned, and maybe it's
Mm-hmm.
dismissed or maybe it wasn't given a lot of time. So
Mm-hmm.
if you have that, often your instinct is right. I will say that. And
Thank
that's
you
what
for
I've
saying that.
noticed.
We talk about our mom gut and
Yeah.
our intuition all the time, and we talk about
Mom
like
gut's huge. Yeah.
especially in the beginning because we are overwhelmed and we're not the expert yet, right? And so there's just so much coming at us that sometimes we don't trust it. So y'all, this is why Dr. Susarla's the best. He just said that himself, like trust your mom gut, trust
You
your
should do
intuition.
that. And I see more often than not, I'm actually reflecting, you know what? It's smart that you did this,
Yeah,
because we want to make sure we improve your child's health. There's something that it's not been communicated very well in the community that the XYZ is a problem. And
right.
so there's often a better way. And if there is not, then I'll be the first one to tell you, thank you for coming to the office. Here's what to look for. Don't worry, your child is okay. You know,
Yeah.
I don't, I'm not in the business of assigning, you know, bogus and unnecessary diagnoses or
Right.
diseases to
Yeah.
the American population. That's not what we
Right.
need.
Yeah, no, that is not what we need. But it is good. Like we need parents to be aware. We need them to be active and involved, and then we need them to work with the doctors. And I think that's the part that's the most important, and why I love going to see Dr. Susarla so much is because it does feel like we're a team, and it feels like we have a plan. And it's a short term, midterm, long term plan. We talk about it every visit. And so, yeah, we're not alone. And everything's talked about, and so that's one of the things that I just really appreciate. And I know, I don't know, doc, if you know or not, but like it's not always like this, so it's good. It's not
Well, I
always.
know whatever we do, whatever we can do to kind of improve the experience, I mean, I believe in medicine. I believe in the practice of medicine. So
Yeah.
I spent so many years in this.
Yeah.
And one of the things that is disappointing when someone has a bad experience, you feel like maybe it reflects on the entire field or all the practitioners in general. And so
Yes.
you want to raise the level of medicine in the community. So not to say that I'm the best in everything, that I won't make a mistake, but if I can just carve out my little space and do it better, I'm
Yeah,
happy.
and give pulmonologists, more people
Yeah.
are talking good about pulmonologists. I love it. Okay, this podcast is called Live Well, Love Strong. Doc, what are you doing in your personal life and even in your practice to live well and love strong these days?
Yeah, that's a great question. Well, we hope we're doing it enough. So practice first, right? So the it would be wonderful in the medical practice if we had something called the highly credentialed multidisciplinary team. We had our nutritionist here, we had our registered nurse here, we had our respiratory therapist. It'd be nice if we had that.
I
In
love
fact,
that.
it's funny, sometimes I'll go on some of the pulmonary medicine use groups and listservs, and they'll talk about, well, how many of these nurses do you have, and how many therapists do you have? And I'll say, you know what, we can't do any of that. So we have to kind of be sort of the the lighthouse for the field. We have to kind of
Yeah.
be able to direct, the team. And
Hmm.
so what we want to do is we want to explain to our assistants that, all the insurance denials, all the headaches, all the extra calls, occasionally an upset parent, we need to communicate to them that the greater good is that we're helping people, we're healing
Yeah.
people, we're finding new therapies for them that they didn't have before. And so, leading in the office for me means like showing them not just the state of the art stuff that they don't
Yeah.
know as
Hmm.
assistants, but also showing how positive an effect they're having in the community. So on
Love
the
it.
office side, that's one thing that we do. On the personal side, oh, we can always do better with this. So, gosh, I remember my father when he saw a cardiologist, probably close to my age, for cardiology related things, and his cardiologist had to have a coronary artery bypass surgery. And so we said, you know what, is that a good cardiologist? Is that
Right.
kind of what we want? So that means that the preventative health things that we keep preaching, because I
Hmm.
like to go back to this,
Yeah.
there is an importance to diet.
Yeah. Okay.
There's an importance to regular activity and exercise and sleep. These three things need to be properly managed. The
Hmm.
teenage age, I don't know if you have any teenagers, but the
Yeah.
teenage kids nowadays, they're all sleep deprived
Yep.
and they're all device dependent.
And they're all
And so
eating junk. Yeah.
they're all eating junk. They're all
Yeah.
eating ultra processed foods, right? So there's an aspect to sort of the prevention, health prevention,
Hmm.
that it's not chiefly in my job description, but I like to talk about it all the time. And
Yeah.
if I'm going to talk about it all the time, I better be doing it.
Yeah.
So I better be doing some of those things. And so I try to do those things whenever possible. If I can shut down early and get more sleep and go have a tennis or pickleball game with my kids, I'm going to do it.
Yeah.
And family time is extremely important. So if I can't switch off, work stuff, even though there's
Hmm.
always work stuff to do, and have
Hmm.
dinner with the family, that's a loss that I'll
Yeah.
always miss.
Yeah.
So the family time and the sort of the activities that are sort of that improve our health are things that I like to focus on outside of clinic. Because if we don't, I'll be run down and I won't be able to keep doing this very much longer.
Yeah, no, I love that. We appreciate you taking care of yourself and spending time with your family. Yeah, that's good stuff. Okay, Doc, we are finishing up. I am going to put all of your contact information on the podcast notes and where people can find you. But tell me really quickly about your clinic, Houston Specialty Clinic, and tell me the disciplines
Yes.
that are in there and the
Yes.
things that are involved.
Absolutely. Thank you for that. Our clinic is called Houston Specialty Clinic. It has offices in Memorial City and Sugar Land. My office is both up in Memorial City and Sugar Land. My partner is a pediatric neurologist, so he also sees a lot of very special needs kids, and then he has a physician assistant and a couple of nurses as well. And so my side of the practice is pediatric pulmonary medicine and sleep medicine. His side is pediatric neurology and sleep medicine. So we have that shared sleep medicine field. We have the shared pediatric focus too. Um, in addition, our website is houstonspecialtyclinic.com. You can find me there. You can also find me on X at Susarla, at Sarat Susarla MD. So you can check me there as well. And we're here for all respiratory and lung conditions related to child health, including
Mhm.
asthma, and sleep disorders like sleep apnea, insomnia, narcolepsy. We manage all those things too. We're a full-fledged sleep disorders clinic as well.
Awesome. Yay. All right. Well, thank you so much, Doc. I appreciate your time. I appreciate your wisdom and your expertise. And yeah, we're just lucky to know you. So thank you so much for coming on the podcast. And I hope that this is very helpful for new mamas, who are starting out and trying to get their bearings in this world of medical
Me
complexity.
too. Me too. I enjoyed it so much. Thank you so much for having me. And I hope anybody needs help can get the right help they need. Okay.
Yeah, awesome. All right. Thank you, Doc. I'll see you
Thank
soon.
you.
All
Bye
right.
bye now.
Bye.